Well, good morning, everyone. We're pleased to be here in Paris to talk about how we need to start treating mental health the same way that we treat physical health, reduce the barriers to access, and make sure nobody has to pay out of their pocket for the mental health services and therapies they need. Folks right now can pay up to $200 for one session of mental health therapy. That's a huge barrier to access. So we can fix this together. We can bring mental health into our public health care system, making sure people can pay for services with their OHIP card and not their credit card. We can boost up access to mental health care by expanding the number of people that are providing services. And most importantly, we can make sure that people like Brandon and people like Maya and like Paul's son are able to access the services where they need it, when they need it, as part of a public system. So we've been thinking about mental health for a long time as the NDP, and we're thrilled to be able to be here to say to folks, there's hope. There's hope that you can get the mental health services you need when you need it without having to pay for it, because it should be treated exactly like physical health. And so our plan does exactly that. Together, let's make it happen. Let's have a mental health care system that meets people's needs, that doesn't leave kids waiting 18 months or more for service. Our plan includes a 30-day guarantee that young people will have service within 30 days maximum if they're struggling with their mental health, and that those services are available to all communities around this province. We're excited about this, and I want to say to all of you, thank you so much for sharing your stories. Thank you, Harvey Bischoff, our candidate for Brant, for being here with me to have this important conversation. There's a lot at stake in this election. What I want to say to Ontarians is together we can fix this. Instead of a premier that works for his buddies, it's time for a premier that works for you. I'll take any questions that folks might have.
So we'll ask media on site to carefully make their way to the microphone, minding the cameras.
It's a little tight in here.
First question will come from Mathieu Simard from Radio Canada.
Morning.
Good morning, Mathieu.
The Liberals are promising to hire 3,000 mental health care workers to improve access. I know your plan mentioned funding to train people, but what's your target? And with the universal system in your platform, is there a chance businesses could stop providing healthcare services to their employees, and which would impact wait lists?
Well, there's a couple of pieces to all of that. First and foremost, we do have a plan to bring more therapists online immediately through helping for paying for the training. We know that there are folks that have the capacity to do this kind of work in communities across our province, including social workers, for example, and nurses and family docs, some of who do some of this work and some of who don't. And so that's a big aspect of what we're doing. But what we hear from people and what we've heard today is one of the biggest barriers outside of access is cost. And so we know that mental health care can cost up to $200 or in some cases more for a single therapy session. And that's why we're focusing on bringing it into OHIP so that we build a system. The system we have now isn't even really a system. It's really fragmented. It's really disjointed. So putting Mental Health Ontario together as an umbrella organization that will help us with all of the details around making sure access is available all over the province, making sure that we're keeping statistics around where the needs are not being met or where we may need to shift focus. This is a part of an entire system. It's a system that we want to build. It's not a matter of a single announcement. There are many layers to what we need to do to meet people's needs, and I'm very excited about the opportunity to really ensure that mental health care is accessible to people.
Just like a follow-up, in order to provide 6 appointments every year, do you know how many healthcare professionals we need?
Well, we're certainly going to need thousands and thousands, but no matter how many we need, if it costs people $200 to go and see that professional, we're not going to have a system that works for people. And that's exactly what we're aiming for. You talked a little bit about the employer piece, and I wanted to address it a little bit. Lots of employers have employee assistance programs, which are fantastic and I think important. And I think that's very, very helpful. We know that there are services that currently exist in community health centers, for example, in other community-based organizations. Mental health is sometimes identified as a need, and so the community-based organization provides counselors and therapists. What we will do is make sure we're funding those services because they have long wait lists, and it's something that Inga was talking about. Lots of community-based organizations try to meet this need, but they're doing it on a shoestring. So we'll be bringing those services into the public system so that those organizations can continue to provide service, but a lot more service, because people need to be comfortable to go to a place where they feel accepted, that they feel they belong, and so making sure that those things are folded in and funded properly is part of our plan.
Next question comes from Liam Casey from the Canadian Press.
Hi, Liam.
Good morning, Andrea. I've done a lot of work on the opioid crisis. It was awful before the pandemic. It has gotten significantly worse during the pandemic. I just want to know what specifically is your plan to deal with the opioid crisis?
Well, first and foremost, we're going to take the unreasonable cap off of the safe injection sites, or safe consumption sites that Doug Ford put on here in Ontario. We also have plans to make sure that we have detox beds boosted. You can't get into a rehab bed without a detox bed, and so detox beds, rehab beds, getting people to a place where they can safely consume in the first place. We know that police chiefs are calling for decriminalization at the federal level. We support that call. We also know that there are folks that within the healthcare system that are flagging the poison drug supply. We need to have serious conversations about that as well. People are in a desperate space, and folks who are experiencing addictions need to have some support to try to help them find a way out of that space. And we are not going to do it by taking away services or by capping services. We're going to do it by making sure the services are there for people when they need them. The other thing is, and we know this, that because there aren't enough detox beds, people can't get the treatment or the access when they need it. When somebody who's addicted to drugs decides it's time to get clean, they need to have the service right away. They need to have access right away because it's a huge step. And if that ability to take that step is restricted because there's lack of services, then the likelihood is that step is not going to be taken. And I think that we need to be really thoughtful about that. So we are going to invest in making sure that the opioid crisis is addressed.
Thank you. There's been a lot of promises from various parties in the election about dealing with the after effects of the pandemic.
Sure.
But switching gears, what measures would you take to help prepare for the next pandemic?
That's a really great question. One of the things that we've committed to is a full public inquiry into the way that this pandemic was handled. Not to lay blame, not to point fingers, but to acknowledge that that there were things that we did well and things that we did not so well. Things that we should have learned from SARS that we didn't, and we can't have that happen again. I think it's very clear that the pandemic that we've just been through will not be the last, but what's also very clear is it wasn't the first. And we have to learn those lessons. When we think about the positives, public health stepped up everywhere across the province to really help people, support people, bring testing and vaccines and supports, in some cases, right into people's neighborhoods, right into community. So they did a fantastic job. In other cases, we saw severe tragedies that could have been avoided. I think about what happened in long-term care, and I think all of us reflect on how we failed the most vulnerable in our communities, and whether that's people in long-term care or the folks that were providing supports to people in long-term care, folks that were on the front lines of the keeping the economy going, particularly in hotspot communities that could have benefited from paid sick days, for example, could have benefited from more attention from their government. These are things that we need to unpack, because we need to learn the lessons about how to ensure that the next time a pandemic hits, we are prepared for it. We also want to see an accountability process put in place, so that once we have a public inquiry, we have the recommendations, we're also annually ensuring that that all of the pieces that would be the preparedness pieces, like PPE, for example, are maintained. Because we know when this pandemic hit, stockpiles of PPE that were supposed to be in place were not, and that can happen again. We also know that SARS taught us the precautionary principle, and we ignored it this time around, notwithstanding the fact that healthcare professionals were sounding the alarm bells in that regard. There's a lot of work to do to learn those lessons, and we have to do that. That's my commitment to the people of Ontario. We'll have the public inquiry, we'll learn the lessons, and then we'll make sure that Ontario will always be prepared for the next pandemic. People deserve no less.
Next question comes from Aidan Chimandi from Queen's Park Briefing.
Morning, Andrea, and everyone
Hi,
else.
Aidan.
Hey, so bit of a double-barreled question with a little bit of preamble, so sorry about that.
Okay.
So it's following on the Narwhal's Ring of Fire story from yesterday. So Ford's obviously touting this at every campaign opportunity, but the reporting, all the Freedom of Information requests shows that the feds aren't exactly enthusiastic as the provinces. The communication between the two levels of government has been lacking despite Ontario seeking federal funds, and the business case is shaky and hasn't really been updated in a while. So in light of everything uncovered in that story, I'm wondering if you could comment on how this new information reflects on the PC's strategy and also yours.
Thanks, Aidan, for the question. I have to say there's a level of government that's not even being addressed here, and that's First Nations communities, and that's very, very troubling for me. We are not going to be doing any exploration, any extraction of minerals on First Nations territories without their prior and informed consent, and without making sure that all of their opportunities are addressed. And so any plan that cuts out the First Nations communities, cuts out the leadership there, is going to not be successful. And so if we're serious about the Ring of Fire, we have to be serious about our treaty obligations and making sure that those relationships are respected, and that those government-to-government conversations are happening. Furthermore, one of the things that I don't hear when we talk about mineral exploration from the current government is a commitment to good jobs in the north. And so we know that mineral extraction happens in lots of parts of northern Ontario, and often those resources are shipped to other parts of our province and also other parts of North America and the world for processing. And that's something we need to have a hard look at. People in Northern Ontario deserve good jobs as well, and it's environmentally more, I think, appropriate to not have these masses of materials traveling far distances for processing. So there's a lot that we would be looking at to be successful in the Ring of Fire project, but we watched for years and years and years as the Liberals kept promising the Ring of Fire was going to actually start to create some economic activity in the far north, and of course nothing has happened with the Conservatives either. But it can't without a plan that involves First Nations.
Yeah, and so on the feasibility study, economic impacts, if elected, would you release that info to the public that the Narwhal wasn't able to get through Freedom of Information requests?
I think that the most important thing to be successful is to be transparent in what you're doing. I don't know why the transparency is a problem in this particular situation. when we don't have information that's available to people, how do you make decisions that respect them and that meet their needs? So absolutely, it's an economic opportunity, but it will fall flat if the economic opportunity is not one that people are behind and support, and they can only do that knowing what the big picture is. And again, when we talk about mineral exploration in northern communities, particularly in First Nations communities, nothing should or could go forward without them being at the table. And the only way they can be at the table is if they have the information that they need to be full partners in any project going forward.
So we'll move to questions on Zoom. We have quite a few hands up. We'll do our best to get to everyone, but if we miss you, we'll follow up right away. First question comes from Randy Rath from CHCH.
Hi, Randy.
You may need to unmute yourself, Randy. Okay, we'll come back to you, Randy.
I got it. Yeah, hi, Andrea. You can hear me now, right?
I can, yes.
Sorry about that. In 2018, in his president's address at the OSSTF annual meeting, Harry Bischoff called on the next provincial government to convene an all-party task force to look into moving to one secular school system in the province, one in French, one in English. He said it would eliminate administrative duplication and that the populace was pretty much ready for this sort of thing, for this to happen. Do you agree with Mr. Bischoff? Should there just be one secular school system and get rid of the Catholic system in this province?
Well, that's certainly a conversation that Harvey, I'm sure, had as the president of the OSSTF with his membership. The NDP has been clear on our position, and all of our candidates have signed on to our position, which is the most important piece of our education system that we need to address right now, is making sure that, as Maya was saying this morning, young people have the quality of public education they need, as well as the supports that they need to succeed in our province, and that is our focus. We won't be cutting education. We will be funding our education system to meet the needs of young people.
Did you have a follow-up, Randy?
Yeah, hi. Can you hear me now? This thing keeps muting.
Yeah, I can hear you.
Okay. If I could ask Harvey, do you still believe that? Or do you still stand behind the need for, eliminating the Catholic system?
Did you want to say something, Harvey?
I'm happy to answer. Thanks for the question, Randy. As OSSTF president, I spoke on behalf of OSSTF and its policies, as I was required to do. As a parent, I have sent all my kids actually through the, the Catholic system. I don't have a minute, I don't have a second to spend battling between publicly funded systems right now. There is so much improvement that needs to be made within our publicly funded system. That's what I'm focused on. We don't have time to waste. We have to catch up and keep up and move forward with the publicly funded system, the entire system, and that's what I'm committed to.
Thanks, Harvey.
Next question comes from Sabrina Nanji from Queen's Park Observer.
Morning, Sabrina.
Hi, Andrea. Can you hear me?
I can, yes.
Okay, great. I'm sorry I can't be with you in person, but I appreciate you taking the question. I wanted to follow up on our story about this organized push aimed at pressuring you to step down if you don't take the Premier's seat on June 2nd. I'm now speaking with some candidates and former MPPs even. So I guess I'm wondering, what's your message to the people in your own party who are telling me they can't win with you at the helm?
Well, I think we have an important election that's upon us, and that's going to be my focus. I'm going to continue to work for the people of this province and to assure them that instead of a premier that is working for his buddies, we can this time have a premier that works for you. And I just encourage all of our NDP candidates as well as members to get on board to provide the people of Ontario with hope for the future. That's what I'm hearing from people everywhere I go in this province. They want to know that they can have a government that prioritizes them, and that's certainly my goal, and it's certainly the goal of our candidates.
Do you have a follow-up, Sabrina?
Yeah, sorry, I needed to unmute myself. If you don't take the Premier seat, I mean, will you step down or try a fifth time and stay on and serve like Kathleen Wynne?
What I can tell you, Sabrina, is we have several weeks left, 3 weeks left now, I think, of this campaign, and that's where all my focus and energy is going to be. You may know my history. I always fight for people. I've been fighting for people before I was even in politics. I can't imagine at any point in my life that I'll stop fighting for everyday people, because that's who I am.
Next question comes from Steve Paikin from TVO.
Good morning, Steve.
Unmute. Am I working this time?
You are. Oh, now you're not.
Yeah, I feel Randy's pain. These things keep muting us. I guess they're trying to shut us up, and I don't blame them. Andrea, the research team from your party has unearthed yet another example of a Liberal candidate who has some problematic digital footprints as part of his past. Do you have any theories as to why your team has been able to unearth this stuff and theirs has not?
I don't know. I don't know, Steve. But what I can tell you is homophobia is painful. It's hurtful, and it's something that we need to call out every time we see or hear examples of that kind of activity and that kind of that kind of painfulness or challenge that people are facing when they're when they're from the LGBTQ2S+ community. We need to support folks, and we can't accept that kind of painful attack on LGBTQ2S+ people. It's just not acceptable.
And as a follow-up, I wonder whether this is going to be the reality of campaigns going forward, in as much as these younger kids eventually get older and have this digital footprint and start running for office, they're all likely to have, or many are likely to have, things on a digital footprint they wish they hadn't said when they were much younger. Is this something that maybe us older folks are going to have to deal with a lot more going forward?
Well, there's no doubt that the social media environment is part of who we are and what we do, and I think it'll evolve over time. But certainly, people need to be thoughtful, absolutely, about what they say and what they do on social media. It's not private; it's public, as you know, and I think this will evolve over time. It's particularly troubling, though, to see some of the hate, some of the bullying, some of the ugliness that exists in that space. I really hope that we can find a way forward that really reduces that, because it's not only painful, but it's hurtful and it's harmful, and it can really impact. We're talking about mental health today. It can really impact people's mental health and their well-being in very, very negative ways.
That's all we have time for, so I'll turn it back to you, Andrea.
Thanks very much, and I was glad to be able to turn the conversation back to mental health services in our province. We're proud of this plan because people should be able to get the mental health services that they need, just like they can get the physical health services that they need with their OHIP card and without having to shell $200 out of their pocket for a therapy session. So thank you again, Maya and Inga. Thank you, Paul and Brandon and Harvey Bischoff, our candidate here in Brant, for being part of this important announcement this morning, and all of you for being a part of it too. Thank you.